So how do we actually do a breast reduction surgery? This is a question that I think is very difficult to imagine. So I wanted to show you a few short depictions here, and so you can understand how what we do during surgery translates to your results. Now, there are lots of different ways to do this, so I'm only going to do the most common ones here today. There's really two different techniques, what's called the Wise pattern skin resection and the vertical skin resection. We'll go over those now, and I'll show you exactly sort of how people do these to give you the results that you want. Keep in mind when you're looking at these pictures, there are several different elements. The first is the area of skin resection. Which skin are we actually removing? The second is the area of tissue resection. What deep tissue are we actually removing, or breast tissue are we actually removing to alleviate your symptoms? The third is what we call a pedicle. Now, a pedicle is a generic term for anything with a vascular supply keeping an area of tissue alive. In breast reduction surgery, we specifically use it to apply to the nipple and the tissue that we keep around the nipple to keep the nipple alive as we move it up. So I've created a depiction here of the two most common techniques we use for breast reduction. Keep in mind there are lots of variations on these, but these are two of the most common. So in the first depiction here to my right, you'll see what we call the Wise pattern skin resection and inferior pedicle. So you see the keyhole design here with a vertical and horizontal limb that translates into what we call the inverted T or anchor style scar. In this depiction, the shaded blue area is what we call the inferior pedicle that we're going to use to actually move the nipple up, and the striped blue area denotes the area of parenchymal resection or tissue resection. Over here in my left hand, we have what's called the superior medial pedicle and the vertical skin resection. So you have just the keyhole and the vertical here, with this shaded area being the way we're going to rotate the nipple up, and that area of striped resection that extends into the area that you don't see, where we're going to actually remove the remainder of the tissue, right? So there's a lot of under the skin resection in this technique, and there's a lot of through the skin technique resection in this technique. Now, it's important to note that you can actually combine pedicles and skin resection however you want. So you can do a superior medial pedicle and Wise pattern skin resection, or vice versa, but these are the two most common techniques. It's important to talk to your doctor about what kind of technique they're doing for you and why, because, for example, in my practice, I will actually vary these things based on the patient's specific anatomy and what they need. Now, it's not always possible to save the nipple with a pedicle, and if your nipple is far too low on your chest wall, it may be necessary to perform one of these different types of skin resections, usually a Wise pattern, and actually amputate the nipple and put it on as a free nipple graft. These are pretty extreme cases and done only very rarely, but again, it's important to go over this stuff with your surgeon to know exactly what technique you're going to use. I hope you found this short video helpful on how exactly we do a breast reduction. We're going to make other videos on who's a candidate for a breast reduction, what to expect before surgery and some of the risks, as well as what to expect after surgery. If you like these videos, check out all the videos on our channel. And of course, these are things that we want you discussing with us and any surgeon, because remember, it's your body and your results that matter.